Hello and welcome to the InFocus series of Drishti IAS. I am Ritu and today's session is about diabetes and why it is rising among children. And this session is important for your GAS 3 perspective. Moving towards the points of discussion part. So first of all, we are going to discuss the introduction about the diabetes, then we are going to discuss about the types of diabetes, then we are going to discuss about the whole scenario of India, and then we are also going to discuss at how to prevent diabetes, and then we are going to discuss practice question problems. Before that, you have to like, share and subscribe to our Drishti IAS channel. Moving towards the before moving to the introduction part, I want to tell you that on the behalf of Drishti IAS, there is a IAS Foundation course across all the centers of Drishti IAS. Currently, we have one course in Karol Bagh, Delhi, and which will start by 26 November by 6 p.m. And if you want to know more information about such classes, you can call on to this number 8010440440. And if you're staying nearby, you can also visit to the offline center. Coming to the next one. So next one is about the diabetes. So diabetes is a chronic, which means long-term condition in which high level of glucose, also sugar, is present in the bloodstream, and a hormone called insulin allows glucose to move from blood to the body cells, which then use the glucose for energy. And as you already know that insulin is made in the pancreas, and diabetes occurs when there is either not enough insulin or the body does not respond correctly to the insulin. So here what we can see that when there is an excess amount of glucose in your body and insulin hormone which is made in pancreas, what it has that there is not enough insulin. So there is a lack of energy in your body. So this situation occurs a diabetes, and there are two types of diabetes we have. Type 1 diabetes, so it usually occurs into the children's, teenagers, and then we have another which is type 2 diabetes. So type 2 diabetes rarely occurs into the children's, and it is called as the we can see the person who have reached the 40 or 50 years of age. So it can be seen among the people who have passed their adulthood. And type 2 diabetes is caused by the body being resistant to insulin, and type 1 diabetes is caused by body not having the enough insulin. So this is the difference between type 1 and type 2. So this is the scenario of diabetes, and this is the two types of the diabetes. Now we come to the next one. Next one is about the symptoms. So in type 1 we have frequent urination. Suppose that any person is going to washroom again and again, or in an hour the person is going to 5 or 6 times, or even sometimes 10 times. So that is called as frequent urination. Then excessive thirst. So you always feel like thirsty after having in fact lots of water. Also you always feel like thirsty. So this is also one of the symptoms. Then fatigue, because of not having enough insulin in the body, there is always a situation of lack of energy, and there is always a situation of fatigue. And weight loss is also one of the factor, and frequent infections. So these are the symptoms. Similar kind of symptoms can be also seen into the type 2, but there can be a difference in time period, so it can be more gradual. So there is a gradual in nature in type 2. And specific behavioral signs: reduce energy for games or activities, or what we can see that develop more gradually over weeks or months, may be less noticeable. So type 2, whatever the diabetes we have, which is less noticeable, and type 1 is more frequent among the children and adolescent. Now we'll come to the scenario. So here we have some risk factor related to the type 2 diabetes. So what here we can see that first of all obesity, then some also got because of the genetics, and some also got because of the environment. So obesity is the factor, genetics is the factor. Suppose that your mother, your paternal side, your grandfather or grandmother have this kind of problem, so there are chances that might be also develop. And then environment also, and obesity, suppose that you have put on lots of weight, So this is also one of the thing. Then what here you can see that intrauterine environment. So there is a term called gestational diabetes. So what happens that in this, the mother gets diabetes during her pregnancy, and that also sometimes transferred to the child also, but it is very temporary in nature, and we cannot be very much sure that maybe it can be transferred to the child also. The child can be the diabetic free also. Then stress and abuse is also one of the factor. Medications is also one of the factor. High calorie processed food. So right now we can see that there is a increase in amount of processed food, like consuming pizza, burgers and various packed food. And so this is also one of the factors. Sedentary lifestyle, if you're not having a proper physical exercise, and if you're just lying down, and right now there's so much of craze of office and various kind of things. So in that situation also, if you're not having a proper exercise, you're sitting continuously for 9 to 10 hours or sometimes even 12 to 13 hours. Into that situation also, there are chances that you might develop diabetes. Now we'll come to the among children. So if we'll see the data of 2022, and this data has been released by Indian Council of Medical Research, around 95,600 children under the age of 14 in India were reported to have type 1 diabetes. So we already discussed that type 1 diabetes is more common among children, and this places India is the highest number of children with type 1 diabetes among the Southeast Asian nation. So what here we can see that most of the children are getting the type 1 diabetes, but recent research also shows that few children and adults also develop the such kind of type 2 diabetes. And this is a matter of research, and this is a matter of worry that why children are getting type 2 diabetes, because this is rare and uncommon among children. Maybe because of the obesity, maybe because of the genetics, maybe because of the environment, maybe because of the sedentary lifestyle. So this is a matter of concern that children are also getting the type 2 diabetes. Now we'll come to the prevention part. So whenever we talk about the prevention and cure, so sometimes temporary medication can help to prevent diabetes, but overall you have to take care of the food, and you have to take care of your physical exercise. And why it is happening and common among the children, because children are consuming lots of processed foods, they are not having proper exercise, they are going through lots of stress kind of situation, they are spending more times on screen, they are not communicating, they are not having a physical exercise, and they are also prone to various kind of stress, school homework and various kind of stressful environment, like home environment is also not habitable. So in such situation, there are chances that children might get these kind of diseases, and if the child is putting up lot of weight, their parents are not taking care of the child, that child is under the obese category. So here we must take care of the food and physical exercise. And what is that? You should have healthy food, drink more water and fewer sugary drinks, and eat more fruits and vegetables. And also at least one should spend 60 minutes a day for the exercise, not on a single stretch that you have to spend 60 minutes, but 20 minutes, 10 minutes you have to spend for the physical exercise. And this is common for the adult also and the children also. And especially in the case of children, the parents has to take care of their diet and the physical exercise. If children is getting and more vulnerable to such kind of the condition, they have to take care of their food patterns, sleep patterns, and they have to constantly check the weight and different kind of if the child is going to frequent urination, if the child is having a stress kind of situation, in all these factors the parents have to be very careful about their children's health. So this is alarming for all those parents and the children who have developed such kind of the diabetes. So in order to prevent, we have to maintain our healthy lifestyle by consuming healthy food, having lots of water and having proper exercise. Now we'll come to the question part. The question is, what is the theme of World Diabetes Day 2024? Affordable healthcare for all, breaking barriers, bridging gaps, diabetes awareness and prevention, access to medication and care. So for this question, I am dropping you a hint that on 14th of November, the world has celebrated World Diabetes Day. So you should find out that what is the theme of World Diabetes Day. Also, you have to, in general also, it is not just exclusively for the children, but if you want to maintain a healthy lifestyle, you have to take proper food and exercise is must. What is happening in today's lifestyle, people are not having a proper exercise, and that's why there are chances that more people are attracting to diabetic disease, and diabetic is a disease which can give birth to other diseases also. So we have to maintain our health. That's it for today's session. I hope you like this session. If you have any queries related to the session, kindly ask in the comment section. Thank you. Have a nice day.
For more informative content, like, share and subscribe, and do not forget to press the bell icon to get the notifications.